I'm Rico Parrio in Faculty of Nursing, Assam Downtown University. So today I'm going to explain to you about endotracheal intubation. Endotracheal intubation is often an emergency procedure that performed in patients or in people who are unconscious and who can't breathe. So definition is the placement of the tube, a flexible plastic tube into the trachea to maintain an open airway either through the nose or mouth. In most emergency situations, is placed in the mouth of the patient. So this is the pictures, that is the placement, which shows the placement of the trachea, the placement of the ET tube into the respiratory tract of the patient or into the open airway of the patient. Purpose is to administer oxygen or by opening up the airway of the patient so that we can administer oxygen, medicine or anesthesia. To remove the secretions, any secretions or blockage, that which helps to open up the airway of the patient, to ventilate the lungs of the patient, to establish and maintain the airway of the patient, to treat acute respiratory failure and persistent hypoxemia. Indication: it is indicated in case of CNS depression. So when there is a severe damage to your central nervous system, your brain is no longer control the breathing. As we know that the brain, the medulla oblongata, which is the part of the brain, it controls or it regulates the respiration of the patient. So when there is a depression or any injury to the brain, so it damages the central nervous system, so that it will affect the breathing of the patients. So in that case, we need to give support oxygen to the patient. Next, neuromuscular disease. Neuromuscular disease, it affects the function of the muscle in your body, including your respiratory muscles. So when the respiratory muscles is affected, the muscles will no longer be able to contract the to contract your lungs. The chest wall injury, when there is any injury to your lungs, and when there is any chest injury, so your lungs is no longer be able to expand. Now, upper respiratory obstruction. So obstruction can be due to trauma or any object that is present in the airway. So these, it can cause the obstruction of the flow of the oxygen to your lungs, so that it hampers the gas exchange in your alveoli. Next, that is the aspiration prophylaxis. So when there is any aspiration of the gastric content, then fracture of the vertebra and spinal cord. Now, when there is a fracture of the vertebra and spinal cord, this leads to the impairment of the respiratory system, as the spinal cord and the vertebra, it has a connection with the brain. So to make you more understand, we need to know that when you breathe, air, it moves into your lungs. Now, the muscles which we call the diaphragm, along with the muscles nearby the respiratory tract, it contracts and it causes the chest cavity to expand. So when it expands, the air is exhaled when your muscle is relaxed, and during respiration, the oxygen, it passes from your nose or mouth into your pharynx, through your trachea, into the left bronchi, into your lungs and into your alveoli, where the gas exchange takes place. Now, in case of respiratory problems, the oxygen level may drop or causes the carbon dioxide to rise. This will lead to the damage to your vital organs, including your brain, heart and lungs. Now, articles required for endotracheal intubation. We need a sandbag or towel to support the neck of the patient, suction apparatus with tubing, suction catheter, ambu bag and mask, oxygen source and tubing, laryngoscope with appropriate size blade, Michael forceps, then endotracheal tube of appropriate size, dilate, silicone jelly, plastic syringe 10 ml, oral airway, and cotton tape and gloves. Now this is the pictures of a different size of cuff and plain ET tube. Now this is the bubble, bevel or the Murphy eyes, which is present in the ET tube. Now the size of the ET tube. ET tube, it has a different size according to age. Now you will see that in 0 to 1 year child, that is we mostly commonly use with 2.5 to 3.5 mm, and 1 to 3 years 4 to 5, 4 to 6 years 5 to 6, and 6 to 10 years 6 to 7, adult female 7 to 8, and adult male 8 to 9. So these are the common size which is mainly used according to the age of the patient. Now this is the pictures of the laryngoscope, which consists of the handle lights or the dull blades. This is how we need to fix the laryngoscope. The Michael forceps, syringe to inflate the balloon, suction apparatus, techniques of intubation, which we need to raise the head of the patient at least 5 cm with a block or towel or the pillow of the patient. Position for intubation, we need to position the patient in supine position, but we need the neck of the patient needs to be extended by keeping a sandbag, towel roll under the neck or pillows. In the procedure, endotracheal intubation, this is the procedure which is mainly performed by a doctor. So the nurse are responsible to assemble the required articles which is needed and to assist during the procedure. So what actually does doctors use during the procedure? That is, after assembling all the articles, preparation of the tray. Now what the doctors needs, that they will hold the laryngoscope with the left hand irrespective of dominant hands. So they will open the mouth with the right index fingers with support of thumbs. Then they will introduce the laryngoscope from right angle of mouth, shift the tongue to the left and go in and press over the tongue. So they need to check for the epiglottis and lift it. Watch for vocal cord. This is the position where the surgeon needs to see and place the laryngoscope. Check for and to see for the epiglottis or vocal cord for the correct placement of the tube. Now they need to take the tube in the right hand, introduce under vision, confirm the placement by auscultation. If the tube is cuff, inflate the cuff. Now connect the source of the tube, confirm the position of the tube either by auscultation or when you connect the tube in the mechanical ventilators or ambu bag, there is a changes in the chest expansion of the patient. After that, after confirming the correct placement of the tube either by auscultation or by chest expansion or by ambu bag, we need to fix the tube with adhesive. This is how you need to stabilize the tube, ET tube. Then connect to ventilate the patient. Connect the patient to ventilator to ventilate the patient. Either or sometimes directly we connect the patient with ambu bag or anesthesia machine or ventilator. Now this is the endotracheal tube in place. Post procedure. Now as a nurse, we are responsible to assess for the nasal and oral mucosa for any redness or irrigation, or we need to check for the correct placement of the tube if there is any, we need to secure the ET tube with a tape, that is to prevent the movement of the tube. Now in the post procedure, place the patient in lateral position, arrange for chest x-ray in order to check placement of the tube. Then apply endotracheal suction as needed. Watch for chest movement, ET tube kinking, obstruction, leakage of tube cuff, and overinflation of cuff. Now, careful watch for the complications. Now, sometimes if we are not placing the tube correctly, if we are not checking, if the not checking for the proper placement of the tube, sometimes the tube, instead of going into the trachea, it goes into the esophagus, or the endobronchial intubation happens. Then there will be trauma to the lips and tooth of the patient when there is so much pressure given to the mouth of the patient during intubation. Laryngeal and tracheal injury might occur. Barotrauma to the lungs, that is due to the damage to the lung from rapid lung air pressure. Then there'll be tracheitis, that is when there is inflammation of the trachea, and pulmonary infection and sepsis. So that's all about endotracheal intubation. Thank you for your listening.